Have you ever experienced limited range of motion or pain during a squat and then added a slant board, elevated your heels, and it magically went away? Well, in this video, I want to discuss how that happens. And no, it's not just increasing ankle range of motion. There are three main steps that is going to bring us from limited range of motion to pain-free, greater range of motion on a slant board. I want to talk about those, but first, we need to understand a very basic overview of a normal squat. What will happen in a normal squat is that the trajectory should be vertical. So we should move in this vertical trajectory, and in order to do that, we have to have enough compression posteriorly by externally rotating, and as a result, that external rotation opens up space in the front, which allows us to move the hip into. So we need these things to happen for a normal, pain-free, good range of motion squat. So with that, let's go through the three steps. The first step that we need to understand is that if we struggle to create downforce the right way, i.e. the pelvis moving the right way, the femur, the tibia, the foot, then what the body does is a substitution or a compensation. It shifts the center of mass forwards. This forward shift of center of mass, typically called an anterior pelvic tilt, is going to allow us to force down pressure into the ground so we can generate force. This is why babies can squat super well with really good form, upright torso, and then we have adults that can't. Their center of mass has not moved forwards. They haven't learned these compensations. And so over time, we start to move more forwards. What this is going to do as it relates to the squat is the forward shift is going to create a lot of compression through the anterior hip, front side of the pelvis. So when we go down to squat, we are met with compression. Well, the body can only move where expansion is available. So when we go down, we start bending the hip. We're descending down, we feel and meet that compression. What we have to do is start to move horizontally. So we are moving in this horizontal trajectory because we have shifted forwards. That forward shift creates down pressure. That down pressure creates compression anteriorly. We meet that compression during our squat. So we have to redirect and go horizontally because the body can only move where expansion is available. So now we understand what's causing the limitation of the squat in the first place. Now, step two, we go on to the slant board. Here's what happens. If you step back on a slant board and do nothing, if you stay really limp, it's going to push you forwards. It's going to make you fall off of the slant board. However, what the body does is it reacts. So when we go onto the slant board, we have this forwards bias. The pelvis creates a posterior bias. So there's a posterior shift, AKA, we know from the previous step, we all are forwards to varying degrees. Now we're going on the slant board, it's pushing us forwards, but the body reacts by shifting the center of mass back. Now, instead of being so far forwards, we're actually back. So now we understand we're all forwards, creating the limitations. We go into a slant board, it creates a posterior weight shift because it's a reaction of the pelvis, the body, the brain. What does that do from a mechanics of a squat? Well, we've shifted back. The posterior shift is going to create a little bit more compression posteriorly, and as a result, whenever we compress posteriorly, we're going to expand anteriorly. If you remember from the beginning of the video when we talked about the good normal squat, we need posterior compression and anterior expansion. So now we're on that slant board, we have shifted back. As we go down into the squat, we don't get met with that compression anteriorly. So we are flexing through the hip. We don't meet that compression, we can then continue in a vertical trajectory. Remember, we were hitting and moving into a horizontal trajectory without the slant board because there was compression anteriorly. Now the posterior shift creates that compression posteriorly to allow that to constrain that horizontal movement and gives us this nice vertical movement. This is why a heels elevated slant board feels so good. We are starting back. Because we're starting back, we have more range of motion and movement to go forwards. This means the knees can push forwards. Why? Because they're not starting so far forwards. This means the ankle can push more forwards. Why? Because we're starting more back. So the big thing to recognize with a slant board is that it's creating this posterior weight shift to combat everyone's compensation of being too far forwards, creating compression anteriorly.